Hi, everyone. Here is my disclaimer. Any views that you hear discussed in this interview may not represent those of the station or the host. Hi, everyone. This is Betsy Wurzel, your host of Chatting with Betsy on Passionate World Talk Radio, where our mantra is to educate, enlighten, and entertain. Folks, I have a phenomenal guest. I'm so excited. I do. I get excited about every guest. And every guest teaches me something. Reading their books teach me something. Today, folks, I have Dr.Jay Baruch with me. He is a New York Times bestseller. His book is called Tornado of Life, and you know how I'm into book covers, so I like the tornado picture. A doctor's journey through constraints and creativity in the ER. Dr. Jay Baruch is also a professor of emergency medicine at Brown University, Alpert Medical School, and is also a practicing emergency room physician. And I want to welcome Dr. Jay Baruch to Chatting with Betsy. And thank you for spending the time. You're a busy guy.
Thank you so much, Betsy, for both having me and a couple of things. Please just call me Jay. And also, I don't know if the book is a New York Times bestseller, as you said, but it's something that if it was, we wouldn't. My publisher and my editor and I would not be disappointed. We'd be enthralled. But just to set the record straight, aspiring New York Times bestseller.
I thought I saw on LinkedIn it was on New York Times bestseller list.
Oh no, I don't know. Maybe this news, but I don't want to oversell the book. But I do think it's worth reading, and if your readers want to push me to that status, I wouldn't be adverse to that.
Well, I'll tell you what, I think it should be. Okay, that's my opinion.
Thank you.
This book, I have to tell you, Dr. J, I have to call you Dr. J.
You can do that.
Your book is so heart-touching. It's so phenomenal that I can actually see it becoming really an international bestseller. But I'm kind of biased towards doctors. I have to ask you, but I ask everyone, is what motivated you to write your book? You've had 30 years experience as an ER doctor. You have a lot of stories. So we'll start with that.
Yeah, I've always been writing. I went to college years and years ago to be a writer and to try to be an English professor. I was an English major in college, and so I've always sort of gravitated towards narratives and writing, and I've always written as a way to sort of process challenging and difficult situations. I can always think better through writing. And I have a couple of fiction books that were fiction short stories that I wrote before this one. And this particular book sort of emerged out of, I think every book speaks to you and says what it needs to be and what feels necessary. And I think the experience of practicing in emergency medicine and being in emergency medicine, plus let's also talk about my experiences as a patient on the other side of the gown. It just felt so important, and it were stories that were not being really written about, and they were not really being portrayed in the media. They were sort of quieter stories, so to speak, that were also just rich with drama and complexity, and I think got at some of the deep issues that many of us, both as healthcare practitioners and as patients and family members, are experiencing.
Yes, and I want to thank you. I thanked you before the interview. I want to thank you publicly for being an emergency room physician. And I know it's not an easy job, and especially during the COVID pandemic, it was highly, even more stressful. And I know that working in the ER, because I worked as a nurse and I worked in the ER a few times. It is stressful. It's high adrenaline. I think you have to be a special type of person to deal with working in the emergency room. You're seeing people when they're not at their best. You have to deliver sometimes tragic news. And what I really loved about your book, Dr. J, is the stories really are so heart-touching. And I know the title of the book comes from one of your stories. Could you talk about that?
Yeah, sure. The title of the book, Tornado of Life, actually emerged from an expression a response a patient had given me years and years ago, and she was someone who is, I hate to say it, but is typical of so many of the patients that we take care of in the emergency department that we don't necessarily hear about. And she's someone who was dealing with, some experiencing homelessness and had some substance use issues and mental health issues, and she was sort of brought to the ER sort of against her will from the shelter because she was sort of acting out. And then when she came to the ER, she was not very forthcoming and the reasons why she was there, and she was, whether it was due to lack of trust or just a confluence of factors of what she was going through. But when she finally spoke, she said, I'm stuck in the tornado of life. And it just so resonated with me, Betsy, but on so many different levels. One, it's extraordinary how people sometimes experiencing great suffering can speak such poetry. But also you realize that, so many of us, so many people in our communities are experiencing their own, tornadoes of life, so to speak. Life is not always fair. And that, I'm one of the fortunate ones in that, there's a safety net below me. At least, we didn't, for many of us, like, we can't drop that much. We'll drop, but we have people to help us out when we hit a tough time. But for so many people we care for in the emergency department, they don't have that. They're constantly playing catch up. And life is not treating them well, and the system is not acknowledging and treating them well either. And it just felt so like such a powerful story to tell. And also, as I write about in that particular story, how it deserves a particular type of response from me, and that if I don't respond to this type of experience in the proper way, I can actually make matters worse.
I think you touched on a lot of important points, Dr. J. I'm sure you're seeing more people coming into the emergency room with mental health issues, the uninsured. Sometimes people use the emergency room as a doctor's visit because they can't go to a doctor. They go to the emergency room as their health care. I've talked on the show many times that the medical healthcare system is broken. I don't have the answers on how that's fixed, but I have seen it. I've talked to several doctors, and I'm sure, like when it says constraints, as part of that constraints, your hands are tied. Do you over-test so you don't get sued? Do you, what kind of constraints are you facing now as an emergency room doctor?
Well, the constraints, they seem endless. The constraints that we're seeing at the moment are the aftershocks of COVID, which is people coming to the emergency departments with problems that were either ignored or were inadequately addressed during the 2 years of when the pandemic was sort of flashing its teeth at us, and as well as the challenges of so many healthcare providers, especially nurses, leaving medicine, so there's less staff, and then you had increased numbers of patients who had social, mental health issues and substance issues has gone up significantly during the pandemic. So we have a lot of people with more healthcare needs, more complex healthcare needs, coming to emergency departments, and there's just not enough beds to see them because so many of these beds are taken by admitted patients who can't go upstairs because those beds are taken. And oftentimes those beds are taken because there's a lack of staff and because they can't get these patients out because sometimes they have to go to nursing homes or other facilities or places that, to be cared for, and they don't have beds and they don't have staff. So we're seeing so many downstream issues that are accumulating, and which is why I think for me at least right now it's actually worse for us now than it was during the pandemic.
Yes, I can see that. I remember, and I'm going back 38 years ago, when I worked in a hospital, and it was always a short staff. They would have the holding room, and that's where I would work sometimes, of the overflow of patients, and they were waiting for beds. I've seen patients waiting in the hallway of emergency rooms, waiting to get a bed up in the hospital part. The short staff is definitely a major problem. You're having doctors retiring, nurses retiring, and who's going to replace them? I have to say, as a past caregiver, your book, so many stories touch up on caregiving. And I do like about your subtitle, A Doctor's Journey Through Constraints and Creativity in the ER, because you have to be creative as a caregiver, as a doctor, as a nurse. You're a detective. You have to find out what they're not telling you. What's underneath that surface? Why are they in pain? Why are they behaving how they're behaving? Do you find that you also have to be a detective?
Yeah, well, we definitely have to be creative. I mean, I just, I feel that, and I feel like so many of us, just as human beings, we are creative. We're not necessarily talking about sort of creativity, but as far as artistic creativity. But I think so many of us, just naturally as human beings, we're curious, right? If we sat down with a friend at a restaurant, they were going through a tough time, we would be curious. We would ask questions. We would poke and we would prod. We would wheedle. We would think about what is not being said and what perhaps way people are talking around the topic. These are just things that humans do, and they seem basic part of human interaction. But somehow, because medicine is sort of branded as a science, we just forget sometimes, or we don't put enough attention to the fact that it's really a communication and interaction between two human beings. And those same things that sort of make us understandable to one another still apply in a doctor-patient relationship as they would apply in the friend, spouse, caregiver, partner relationship or whatever. And yet for some reason, because it's evidence-based, because it's so science-oriented, we sometimes forget that. And why that's so critical is because patients come in and they don't give me information. They tell me stories. And we still have to bring those tools to the conversation to try to figure out, what is the heart of what they're really trying to tell us.
Yes, and sometimes you really have to do a lot of deep digging, especially if a person isn't verbal.
And I feel like sometimes, Betsy, that we're so, as physicians, I think it comes from a good place most of the time. I think we'd like to find answers. Like people come to us and we feel like the expectation is we need to find the answer. And sure enough, like there are situations where we better find the answer. If you come in with symptoms of a heart attack, we better diagnose a heart attack. Stroke, we better diagnose that. There are certain situations that demand that level of timely precision, but there are so many other situations where where people are trying to understand and experience, and the model of just trying to reach for an answer and only listening for that information that can potentially give a concrete answer is not what the patient wants. I mean, they want to be understood. They want to know that what you're telling me, is what I'm hearing. I'm picking up on that. And if what you're telling me is full of anxiety or frustration or fear, and you want me to probe and ask questions, I do that too. And so I think sometimes what we need to do as providers is we have to sometimes learn how to ask better questions of our patients before we necessarily start thinking about, like, what is our response going to be.
That's a good point. I love the story where you have a patient and she asked you for a hug.
Oh, yeah.
And I just love that, because in nursing, way back in the day, we would call that tender loving care. And we were taught, because I worked as a licensed practical nurse, and I did bedside nursing, and we were taught, tender loving care. It's okay to give a hug. Now, in this day and age of the Me Too movement, and, how do you know the boundaries of, is it okay to give a patient a hug?
Yeah, and in that particular piece, Betsy, what initially motivated me to write it is just, there was certain conversations going on about, like, you always give patients a hug, or it's always important to hug your patients if they want a hug, and there were certain patients that I was like, that it was like the pinnacle of my day, or the pinnacle of my night, like getting a hug from a kid or getting a hug from from an appreciative patient. But this particular, situation, I wasn't certain, and of course it also is, as the readers will discover if they have the chance to read the book, is that I thought it was initially I took some pleasure and some honor in the fact that she felt inclined to hug me, and then I sort of later realized that she wanted hugs from everybody. And maybe there was nothing that was particularly special or empathic or something she read into me that made me stand out as someone who was worthy of hugging. And I dissected all the different decisions and all the different emotions that could run through the moment of sort of when a patient asks for a hug, because it's such a deeply human and powerfully human gesture that is so loaded, and it's not like other requests for, like, treatment in medical care that we can say no, that's okay, we don't think you need this or that, or I'm not going to do this or that. This is something that a rejection or saying no feels entirely different at an entirely different level, and so that was like a really fun piece for me to sort of dissect that out in all its layers.
Yeah, I thought that was a great story, because we all could use hugs at times, and if you're in the emergency room and you're scared, you might want a hug, from someone, and I could definitely understand that. Because I was a caregiver, one of your stories about caregiver burnout really touched me. I think I cried through that story, because it touched me deeply, because this daughter brought her mom in, and she was hoping to have her mom in overnight so she could get a break. And caregivers do get burnout, and I want to thank you for writing that in your book. I think it's a great story. It's so important for caregivers not to get to that point of burnout. I understand it, but I really am glad that you wrote that in there. Actually, we took my mother-in-law. She had Alzheimer's. We took her to the emergency room so she could get admitted to the hospital and then go from there into a nursing facility. But she had such a change of behavior that, doctor said, just bring her to the emergency room. And that was a very touching story.
I know. It's such, and it's, and I think, and thank you for saying that, by the way. It was really, it was important for me to write that piece because I feel like we don't talk about the many ways that often the situations that bring people to the emergency department are multifold, right? And even if the patient isn't necessarily experiencing what the providers might think is, let's say, an emergency or someone who's worthy of who needs admission, many times when you sort of probe deeply, you realize that your real patients are actually the caregivers who are stressed and burnt out, or haven't slept, or juggling so many different responsibilities, and they're like sometimes the sickest person in the room is the caregivers, and I don't think we pay attention to that as much, and we must do that in the emergency department, or at least be open to being sensitive to that. And sometimes even when caregivers aren't necessarily seeking respite from, let's say, admitting their family member to the hospital for a break, I often find that just acknowledging what they're going through and telling them they're doing a great job, and we realize how hard it is for them to do what they're doing, is something that is so easy to offer up, and I think we pass up on these opportunities to really applaud our true heroes, because a significant percentage of our patients, of people in America, are caregivers.
Yes, and it's starting to change a little bit. I think more physicians are asking the caregiver, how are you doing? And, do you need resources, which finally is happening. And I don't want the audience to think I'm morbid, but this story touched me. Forgot the name of the title, Dr. J, but you had to, unfortunately, tell parents that their child died. I think they were in a car accident.
Right.
And I liked how you handled it, because you said something to the effect, I don't know how you feel. And
right.
I don't like it when people say, oh, I know how you feel, when they have not experienced that loss. And I really liked how you handled that, because you have to tell people many, many times about a loss in their family. And I'm sure telling a parent their child has died is probably the worst. I can't even imagine saying that. I remember working, it was Christmas Eve, actually, in the intensive care, and a teenager died. And the parents, just devastating. How do you cope with that emotionally, Dr. J, to be able to deliver that news and still remain, I don't know what the word for it, like, I know you have to kind of detach yourself in a way, but you don't want to lose your soul, your humanity. How do you do that?
It's hard.
I can imagine.
I wish I had an easy, or at least a polished answer for that, or at least I could give you the impression that I figured it out, and I haven't, and I ended that piece with its acknowledgement that that there's no hiding behind the white coat, and that through the years it hasn't become easier, and I hope it never does.
Yeah, I can understand that. Yes, when you're working in a medical profession, and you see people dying, and during COVID you saw more people dying than you normally would have. You know, they say that doctors and nurses get cold after a while. What people don't understand is not that we get cold, but I think you have to have some kind of a detachment in a way so that you could sleep at night, so that you could live a normal life. But what people don't realize, Dr. J, is that I'm sure emergency room physicians, and I know nurses, I know I did this myself, you go home and you think, did I do the right thing? Did I say the right thing? Did I order the right test? You know, and you catch yourself, and you could drive yourself crazy, second-guessing yourself.
Right, and in the piece, you know, I write about how, oftentimes, we all have these nightmare scenarios, as parents, as wherever about, like, God forbid this ever happened to my child or my loved one, my family member, my friend. And unfortunately, like when I, when I go to work, those nightmares, are real for certain people, and so you become adjusted to you can't pretend that they don't happen, because they happen, and you do try to, like, there are certain situations where it is hard. It's not just hard to give this news, which is going to change lives forever, right? But the fact that, like, it's just, then you have to go back and just go about your day, and you have 20 people waiting for you, and you're going to have, sometimes you have people yelling at you for taking so long, because you spent 20 minutes with the family and trying to talk to them and answer their questions, and that might have been after you spent a half hour, an hour trying to save their loved one. And then you have the questions about, wow, could I have done something differently that could have changed the outcome? So there are so many variables to this grief, to this, and then for me, it just never hits me, the fact that and I write about this in that piece, that we leave the family room, and there's all this, like, life going on, and this family is like, what does laughter now sound to them when there's laughter in the hallway, or just the light in the hallway, and how does that greet their eyes when they emerge from this room? And I'm going on 30 years of doing this, and even last week I had having such a conversation with a family, and I haven't figured it out, and I hope I never do, because I do think every family and every situation is different, and I don't want to become cold to this part of what we do.
Yes, I can understand, and thank you, Dr. J, for sharing that, because I want people to know that doctors and nurses have heart. They are not, cold robots. They are human. They have feelings, and I want the audience to know that. I'm going to sidetrack here, Dr. J. I would love to see this in the future. They do have pediatric emergency rooms for kids. You know what I would like to see? I would love to see an emergency room just for people who have some kind of dementia, so they don't have to wait 5 or 6 hours in an emergency room. It happened. I had to take my husband, who had early onset, to emergency room because he had changed behavior, and they wanted to rule out if Matt had any infection, which, of course, can exacerbate the dementia. So he didn't have any infection, but we waited at least 3 hours before he went back. So Matt was already agitated. And then I wanted to coax him onto the stretcher, and they don't have the time. They just picked him up and practically throw him on there. Of course, that got him agitated. Then he had to be in restraints and medicated. But as it turned out, he didn't have an infection. He was just progressing, unfortunately. But I just wished that they would have had where he could have went in and been assessed. And I dream for that day. Do you think that would happen?
Yes, I do. I will tell you that I don't want to be overly enthusiastic, but I will tell you that over the last number of years, there actually are people within emergency medicine who specialize in sort of geriatric emergency medicine or geriatric care, doing great research in those areas. And we have conversations about that, especially about the care of patients with dementia, because not only is it the weight, and not only is it the is it the fact that sometimes caregivers need and the family need assistance, and during the pandemic they weren't even there for that either, right? It was triply awful. But also the fact that the emergency department is such a suboptimal place as it stands, with all with the busyness and all the stimuli going on around. Sometimes the sleep-wake cycle is all screwy. Sometimes we give medications that might not be optimal for someone who is older and with someone with cognitive difficulties and dementia. And there are people working on that. I think right now so many emergency departments are dealing with just crowding issues that to pick apart and say, listen, now we're going to find space for just for this group of patients is ideal, but it's kind of hard, and we try to do it in certain ways on the fly and try to adapt to particular situations, but to have a particular space with that is quiet, that has sticky stuff on the floor so people don't slip, that is more receptive to patients who have dementia would be wonderful and ideal, and I do think it's going to happen at a certain point in time, because there are excellent people who are devoting their brilliance and their energies to those challenges.
Yes, I would love to see that. And I have to ask you this. I forgot the name of the chapter in your book, Dr. J, but it was, I think the person had cancer, and the family wanted everything that could be done, and I think you asked if they had a medical directive. And I don't think people, understand that. And you as an emergency physician, I tell people, I run a support group, but I tell people a lot on this show, it's so important to have that power of attorney for medical and the medical directive living will. Could you please tell the audience how important that is for them to have that? And do the emergency room physicians staff, do they honor that? Because people think, they don't honor that anyway. So I like to hear it from you, because you're the authority.
Oh my God, yeah. So we're like I have my background is in bioethics. I've done a lot of work in bioethics, and so for your audience, who don't know or might want to know more, and advanced directives or sort of documents that basically to make it simple to understand, like they speak for you when you can no longer speak for yourself. And usually it involves end of life decisions. Oftentimes it's focused on, procedures or interventions at the end of life, whether it involves, stuff like intubation, having an advanced airway, being attached to a breathing machine, to getting cardiac compressions, or getting shocks, which you see on TV, or getting big IV catheters and special medications to keep you alive. But ultimately, it's really about goals of care and how you would envision the end of your life, if you could. Like if you were in a particular situation, and you can wake up at that second and you saw the situation where you were in, how would you like to spend the last part of your life? What do you value? Who do you want nearby? Do you want to be made more comfortable versus having people press on your chest if you have, when you have no possibility of recovering? These are all difficult questions, and sometimes the documents are hard because they can't anticipate all foreseeable opportunities. So you have what you were talking about, which is you'll have, somebody who's a proxy who will speak on your behalf when you're unable to speak for you, and hopefully, that person is designated. It's assigned beforehand. You make that decision, and also you've had the discussion with these people, this person, about what you would want. They know you. They know your values. They know what you would like at the end of life, when you would like to be aggressive, and when that aggressiveness is really just being made aggressively comfortable. And they're really, really important, and they're incredibly important conversations to have.
Yes, and I say this, I've done a lot of shows on this, very proactive in saying to my audience, I've done many shows about it, being proactive, plan your end of life, had that medical directive. I think everyone from the age of 18 should have it. It could always be changed, but you want to be able to tell the emergency room physician, you have an 18-year-old or older, what they wanted, what they planned on. And people might think I'm kind of morbid when I bring that up, but we have to have these conversations. And, folks, there's like certain people you want to clone. I would love to clone Dr. J. I would love to clone you, Dr. J, and put you in every emergency room in the world. There's so much that I could talk to you all day. How has being a writer, how does that affect your medical side? Then like writing, this might sound silly, like writing doctor's notes. Do you find that you get more creative, or does being a doctor give you the creativity to like write your book, or is it a mixture of both?
Yeah, I think it's I don't necessarily I don't doctor to write. I went to, I was going to be a writer, and I found myself going into medicine because of my fascination with stories, and having the knowledge and the training and the experience to impact stories was really one of the primary motives for me. And I felt like I can do these things that I didn't feel like I was seeing at the time from physicians, because I came from a world of writing and a lover of literature and a lover of fiction, which also means that we're all sort of quasi-experts at complicated characters if we're lovers of great literature. And then from my writing, there's so many of the aspects of medicine, Betsy, that I thought were going to be really terrifying, or I was most scared of when I went into practice. Usually life-threatening stuff were terrifying, but I was prepared for it. I was trained well. That's why we spend all those years in medical school. That's why we spend all those years in postgraduate education, like learning, like for me, emergency medicine, and learning the skills of emergency medicine, and working with some great faculty who taught me, and also, more importantly, being open and learning from my patients and their families. But the things that really troubled me the most often was facing uncertainty. And when the answer wasn't explicit, when patients came in with, I thought was really important stories to tell, and I was at a loss in how to respond. And they were really, and sometimes they got framed as difficult patients, but really what they were difficult stories. And I found myself by necessity leaning on my creative writing skills and thinking more like an artist at the bedside, and thinking like a doctor, and having all the medical knowledge and the knowledge of the medical literature and the evidence was important, but none of that was important if I didn't first get the story right, if I didn't understand this particular person at this particular time with this particular set of needs. And those types of skills require the types of probing that I got in my creative writing. So like overall, I know that studying writing and studying literature made me a better doctor.
That is so awesome. And I know we didn't get into that. You were a patient, and it's been rumored that doctors and nurses make the worst patients. That's been long, that's been told like way back when I was working in a hospital. They said, oh, you don't want a doctor as a patient or another nurse. How were you as a patient, Dr. Jay?
I was in denial. I was fine. Like I was as an ER doc. You realize that you're I'm grateful for everyone. I was the people who made my experiences so easier or palatable and provided solace for me were really like the nurses and the techs and all the people who don't get nearly enough credit in the medical experience who so deserve it. And of course, I had some good doctors as well. I don't want to leave them out either. Also, I found, Betsy, that as narratives, like the people had this idea of like the doctor as patient narrative, and that suddenly it was going to be this transcendent moment, and that we were going to learn everything, and we're going to be like much better doctors as a result of it. And I just didn't like being put into that narrative. Because there were certain things that, yes, I feel being on the other side of the stretcher and being more horizontal made me aware of aspects of being a patient that were particularly scary that I didn't recognize it at that level, just something as simple as waiting for test results. But there were some things that made me more, I became a little bit harder on some patients as a result of being a patient myself and saying, listen, you can go back to work with us, or you should be much nicer and more appreciative of the staff and not yell at us. So it's like most of the pieces in the book. The situations are messy. They're not one thing or the other. They're everything. They're rich. They're rounded moments rich with complexity. And so I found the experience as a patient was equally rich as complex as well. And yes, in the end, I definitely think it made me a more multifaceted and sensitive physician to the little things that often we don't pay attention to as physicians when caring for our patients.
Thank you for answering that. I find that sometimes, as doctors, nurses, we might have more compassion after we've experienced being in a hospital or having a surgery, facing an illness. My son's doctor told me that she was diagnosed with Parkinson's. Yeah. And when my husband came, he would come with us, and I took us to the doctor. She had asked me if Matt had Parkinson's, because Matt did look like he did have it, but he didn't. And I said, no, he just had early onset. And I told her, sorry that she had that diagnosis, and I asked her if she needed resources. And I told her, about resources, and I felt really bad for her. I'm glad she told me. I'm glad she felt comfortable to tell me, and that she allowed me to give her resources. So even, doctors are human beings, folks, and doctors need resources too. And doctors may not know about resources. And I just, I want to thank you, Dr. Jay Baruch, for coming on my show and for writing this book. Folks, you need to get this book. This book is so heart-touching. So many wonderful stories, so many stories that will make you think, and maybe make you think of your own experiences. And maybe when the next time you go to the emergency room, you'll be kinder to the staff. They're doing the best they can under the circumstances that they work with. And it's not easy. And I want to thank you, Dr. Jay, for being an emergency room doctor, for doing all that you did to help people during COVID and all the time, and writing your book. The name of it, folks, is Tornado of Life, A Doctor's Journey Through Constraints and Creativity in the ER. Where can they purchase your book, Dr. Jay?
Ideally at local, either at local bookstores, those buildings that have books, or independent bookstores online. And there's also it's also available for sale on that online behemoth that begins with an A.
Yes. And where can people reach out to you if they would like to connect to you after they read the book?
Oh, please, yes. The best way is through my website, www.jaybaruch, JAYBARUCH.com, and there's a form there for them to reach out to me.
Thank you, Dr. Jay Baruch, for coming on, and best of luck to you. I hope you become international bestseller, and I could see it. I mean, you are. There was a doctor actually who wrote a book and came on my show, but I'm sure he's on many shows. He became a bestseller, so I believe you will be. And just thank you for all that you do to help others, and I really appreciate you spending your time. You're a busy guy, so I appreciate you taking time out of your day to come on my show, and I hope to see another book. I really hope you do another book with more stories. Stories are important. I tell people all the time, share your stories. We learn from stories. We learn from each other. Your book is a perfect example of that, of all the stories you learned from your patients, and now we can learn from them and learn from your experience. I think it's a fantastic book. Holidays are coming up, folks. I would get this book. Hey, do you know an emergency room doctor or a nurse or anyone? Be interested? I would get this book. Is awesome, totally awesome. And I want to thank everyone for listening. You're welcome. All information will be in the blog that Jeannie White, who's station manager, Passionate World Talk Radio, writes. And thank you, Jeannie, for doing that, producing the show. Excuse me. I want to thank Lillian Caldwell, CEO of Passionate World Talk Radio, who makes this all possible. Thank you, folks, for listening. Please share this podcast. Please subscribe. It is for free on Amazon Music, iHeart, Spreaker. You can listen to it on PassionateworldTalkRadio.com. And thank you for listening and sharing. When you share my show, you are helping others, and that's my mission and vision, is to help other people to have a better life, to know about resources. And as I always say at the end of my show, shine your light bright, and in a world where you could be anything, to please be kind, because if we were all kind and shined our light, it would be a much brighter, happier, peaceful world. And that's what I have to say. Thank you, everyone. This is Betsy Wurzel, your host of Chatting with Betsy at Passionate World Talk Radio. Bye-bye now.